You know, we talk all the time about, and we have on the radio. We've even talked about this on the radio, about different people we interview and like from the movie Rounders, the poker movie with Matt Damon and Edward Norton. They're tells, the little tip-off things.
Oh, yeah.
You know, you do have one.
Do I?
When you are really intense about something, when we have a guest in the studio that you really want to get into the nuts and bolts of a topic, you chew on your thumb.
Do I chew on my thumb?
You were just chewing on your thumb.
Well, my nail was goofing up. So
Daniel Erspamer, the president, CEO of the Pelican Institute think tank of Louisiana, is here.
Boy, and he's got his panties in a bunch today. Man,
look at you! You're already off and running. I'm going to let you guys go. I'll just jump in.
You have made a point that Medicaid expansion in Louisiana is costing us so much money because people on the lower income are deciding to let their private insurance go and sign up for Medicaid expansion. It can't be right, Daniel. That can't be happening.
Boy, you sure wouldn't think so, would you?
No.
You wouldn't. But here's what we found. We have been engaged in public records requests from the Department of Health. And the sad fact of the matter is, well, there's two pieces of this. One is the headline, to your point. It seems that upward of 35 to 40% of enrollees in Medicaid expansion had private health insurance prior to coming on to the Medicaid rolls. Perhaps even the scarier piece of this is the state just stopped tracking that number.
Why?
That's a great question. It was too hard. It didn't give you the information you want. It's hard to say.
Okay.
What they'll tell you is
let me say, because they didn't want to know.
That's right.
So what's the threshold for people at the earning level? Because, I mean, there might be people listening going, hey, I'm going to do that too. Heck.
Don't do it.
If I can save some money.
What? The government encourage bad behavior in
No,
America?
no, stop that. If somebody else can get it and I'm eligible too, why not me too? That's the Me Too movement for me. Me too. I want some of your money.
Me too. I want free stuff.
Yeah.
That's
So
right.
what's the threshold?
Yeah, we're talking about $16,000-$17,000.
Okay.
It gets a little more complicated with dependents and all of
Right.
that. But that's right. And the rules are supposed to be set to where you can't do that. That's not the way it's supposed to work. But of course, these big bureaucracies, I mean, not only have we seen that, but 1,600 people who are making $100,000 or more were found to have been enrolled in Medicaid expansion, including one participant whose salary was greater than the governor's.
Let me rephrase it this way. Okay, let me try this. The government doesn't, in its entitlement programs, encourage bad behavior. It encourages people to become wards of the state, i.e. dependent on the government, i.e. under the government thumb. Is that a little better?
I think that's right. And here's the sad truth of it. Medicaid coverage is not what people want. We have, I think I may have cited this on your program before, just since Medicaid expansion, these are our 2017 numbers, so it's gotten worse. 5,000 people from the traditional Medicaid population have died on a waiting list for a procedure since we've expanded Medicaid to 500,000 able-bodied adults. There are 1.4 million people in Louisiana on Medicaid.
When Governor Edwards expanded Medicaid early on in his administration, almost 4 years ago now, I guess. And everybody is like, whoopee, because it's free health care and the government's going to pay for it, meaning the federal. The first couple of years, explain to me the details, because eventually the vast majority of the money, of the coverage, of the burden falls back on the states.
That's exactly right. This gets worse and worse every year for the state. Now, this is what's amazing, though. You know, this is free money. We're not paying for it. Well, last time I checked, I still pay federal taxes, and I think both of you do as well.
Oh, yeah. Mm-hmm.
And so I'm paying for that, too. Let's be clear about that.
Yeah, whose money is it?
Yeah,
Right.
that's right. There's no money tree in Washington that's raining down free health care for everyone. But that's right. Every year, the federal government pays less and less and less of the cost of our Medicaid expansion. In just a few years, we'll be at 10% that the state is paying. And we're talking, if you thought we had a fiscal cliff a couple of years ago, we're talking $1 billion shortfall if we don't fix something.
The folks with the Department of Health, are debunking your numbers, and they say that the clear majority of those who enroll under the expansion are working, but low-wage individuals who could not afford to pay the monthly premiums. Your response to that?
Yeah, well, the first response I'd say, show your work. If that's true, why did we have to go through public records law to get the data from the Department of Health and then to find they weren't tracking it anymore? So I have to confess, I'm a little skeptical of the response. But let's grant it for a minute. Let's say that's true. Putting people onto Medicaid expansion is the worst possible outcome here. If our objective, which I think is mine and yours, is first to help those the most poor and most disadvantaged who really need it. Let's give them a hand up and find some assistance for them. And then for those folks who are struggling at the lower end of the middle, I totally understand that. There are better ways to do this. Perhaps we can help subsidize a portion of their premium. But the objective should not be to move people on an inefficient government program that people don't like, that is have a shrinking provider base as we expand the number of people going into it. This is not good policy, and it's not good for people. We can do better. We can find other ways to help the people who need it without making another federal bureaucracy and another government boondoggle.